Please join us every week for a new episode of Understanding the Human Condition with Dr. James Flowers. Dr. Flowers and his most admired mentors, respected colleagues, and VIP guests will share valuable insight into underlying health causes, conditions, and issues. These in-depth yet approachable episodes are a great resource for both private individuals and industry professionals. Our esteemed host, Dr. James Flowers, is one of the most recognized and respected names in the field of chronic pain, mental health, and substance use disorders, both nationally and internationally. Dr. Flowers is the founder of J. Flowers Health Institute, located in Houston, Texas. For more information about J. Flowers Health Institute and its concierge services, go to jflowershealth.com or dial 713-783-6655. And be sure to mention this podcast.
Welcome to Understanding the Human Condition with your host, Dr. James Flowers.
Hey, Robin. How are you?
I'm good. How are you?
Good. We've had a good time preparing for this. We have an exciting guest. I'm Dr. Flowers. Welcome, everybody.
And I'm Robin French, your co-host. You're Ed McMahon.
That's it.
You're Ed McMahon.
You're a beautiful Ed McMahon.
Oh, that's sweet. Thank you. And today we've got James Johnson, and he's the co-founder of Bounce Hydration. And he has the tools to make you feel like $1 million using IV drip therapy. Plenty of celebrities swear by it, and we want to talk a little bit more about that, how you'll live your best life by a few drips a month, right?
We will. Thank y'all so much for having me. I appreciate it.
You bet. So glad you're here, because guess what? We get to get hooked up.
Oh, you do?
Oh, you're not?
No,
I
I'm
am.
not.
All right.
You're on your own.
That's fine.
Yeah, and we're going to do it live here on the air so that all of you can see that it doesn't hurt, and it's really easy, and it's mobile. You can do it in your office. You can do it in your home.
Yep.
And
that's right. Yeah, we're
wherever you're
100%
at.
mobile, so we come to you. So
I love that.
No having to go into the store or into a clinic or anything like that. They literally come to our 23rd
They do.
floor 23rd floor suite and hook us up and work with our patients, and
Our staff
we try
love
to have
it.
all of our patients
Patients
do this,
love
and
it.
they love it.
They do. Yeah. Yeah,
So,
he's a big
super
huge-
excited about this.
Great
Yeah.
idea.
Yeah. What do you have today?
so we kind of have the Dr. Flowers special today.
There you go.
Flower
Good.
power.
So one of the things that I totally believe in with this is high dose vitamin C, which we always give Dr. Flowers. It's really, really good for not just immunity, but also for your skin, for all kinds of organ functions and things like that. So that's the main part of it. We have a bunch of B vitamins, and we're going to give him some magnesium just to relax him today.
Oh, he's had a tough week.
He's had a tough week.
month, really.
Yeah, we've had a tough month with high acuity patients this month.
We really do.
Yeah.
Yeah. And even, I mean, your all of your personal hours are being spent on these patients too. I mean, you're putting in
It's been a long
days.
12 and 15-hour days this week, which is crazy.
Yeah. So you need some super juice.
Super juice.
Get him
Love
hooked
it.
up.
Energy,
That's
energy,
it.
but relaxation, right? Yeah.
Yeah.
Well, we were talking about this yesterday. Ideally, if you can do 2 of these a month, it's the best, right?
Oh, yeah, definitely, yeah. And everybody has their own kind of lifestyle, which also plays a large part in it. If you have high stress, like Dr. Flowers here, or maybe you just like to be on the go and like to be on top of your game all the time, a couple times a month is really, really good for you.
Yeah.
Good.
Absolutely. Well, let's do it so we can
Let's get him
keep
hooked
talking.
up.
Yeah, we can talk through it while we get hooked
because
up
I
here.
have tons of questions too. Because this was fairly new to me. I just learned about this when I started working for you a year ago.
Yeah, today.
Today is my anniversary.
That is so cool.
One-year
Happy anniversary.
Thank you.
Wow, I chased you for months. It took a long time to get you to say yes.
I can't believe you said that on air. I love that.
I did. I chased you
That's
for
awesome.
months, and you kept saying no.
And now look at us. Now
And
you're
now
like,
here
you're
we
too
are.
close to me. Move over.
Move over. Exactly. Truly, this IV bag, if you're feeling run down, you're tired, you're fatigued, you have chronic pain, you have fibromyalgia, there are so many different conditions that this works for. But there's a lot of benefits to IV hydration. And James, talk kind of loudly because the microphone's right there, but tell us some of the benefits that you see and a little bit about you and your background.
So, me and my background, I'm an RN, and I ran surgery centers. I've worked in surgery pretty much my whole RN life, and then I've always had like a little bit of entrepreneurial spirit. And just realized that this opportunity was kind of presenting itself in the world in Houston, and got with a business friend, or a friend of mine that's now my business partner, and we kind of came up with the idea to do IV hydration. There's plenty of needs, and Houston definitely is ready for it.
Yeah.
We're definitely becoming more of a
I won't look.
Progressive.
progressive society, yeah, for sure.
Yeah.
All
Yeah.
right, quick little poke for you.
All right. Yeah.
It was
That's
easy
it.
though, right?
That's it.
Yeah.
That's
Yeah,
it.
it really
we
was.
put a little bit of lidocaine on there to kind of help numb the
Yeah.
little
Did I
stick.
flinch?
Other than that,
No, I don't think you
Everything
did
went
at
well.
all.
Yeah.
Mm-mm. And now, talk us through it. So you stuck that little needle in there, and now you're just gonna hook up the juice and.
Yep.
now
And
we're gonna
the-
hook up the juice. We're gonna turn it on, and Dr. Flowers is gonna just
Yep.
gonna let it run naturally with him, and we can slow it down if he wants us to. I'm gonna put a little magnesium in there in just a
Yep.
second, and what it's gonna do is just kind of relax him. It's a natural muscle relaxant. It's great
Yep.
for your heart. It's great for all kinds of conditions, immunity, everything. So
Yep.
it's really, really nice if you're stressed out.
Yeah. He even came to my house when I had that onset
Yeah.
of bronchitis, and
On a Sunday.
On a Sunday.
Sunday morning we
Came by
text
the-
him,
came by
and
the
he
house.
said, "I'll be right there." I love that.
he makes hotel runs. He makes house calls. He does pretty much anything, and I absolutely always feel the benefits of this, and so do our
I love
patients.
that.
So tell us more about how did you get into this with your background? What made you say, I think this would be a great opportunity for me to do IV hydration?
So along with the business aspect of it, just thinking, a cool little business to start. Actually, when my kids were young, I'm telling on myself here, but when my kids were young, they would get sick. I say 10, 11, 12 or whatever. I would just grab a bag of fluid and give them a bag of fluid at home.
Yep.
And just try to let them naturally heal themselves, little sniffles or whatever.
Mm-hmm.
If they didn't heal themselves within, a day or so, then I would take them to the doctor, of
Right.
course.
Yep.
We'd always kind of consult with the doctor. But initially, a lot of times you just kind of feel run down and you feel sick. You put some fluids in you, and
Yeah.
electrolytes, and you just pep up really, really
right.
quick. So I've kind of always done this in my life. And then along with myself, I have autoimmune disorder. I have ulcerative colitis, which I've actually it's kind of opened up the doors for my business too. We're helping a lot of
Yeah.
people with autoimmune disorders. So
Yeah, let's talk about that.
with that, you have a lot of inflammation in your gut, and it causes stress. It causes all kinds of stuff, problems, and you don't absorb what you need to be absorbing so your body can function
Yep.
at 100%, or even 90%,
Yep.
at a higher level. So, IVs immediately, it goes straight into your bloodstream, and you're allowed, your cells just soak it in right away.
Yeah.
So you're using 100% of what you're putting in. If you are not feeling well and your gut is out of whack, you're stressed out, your body is not absorbing
Yeah.
what it needs to absorb. And so you're not getting the nutrents you need to help heal
Right.
yourself so you can mentally and physically get back to back to normal.
What about IBS?
So it's all
all
very
the
very
same,
all,
isn't it?
all
Yeah.
very almost all the same.
Because it's basically an inflammatory problem.
Inflammatory
Yeah.
problem, and that's what actually just chronic illnesses in terms of like heart disease. Now autoimmune has surpassed heart disease as the number one illness in the U.S.
I believe that. We
So-
see so much of that in
Yeah.
our patients every day.
Yeah. We
And so
do.
it coincides with stress, anxiety, drug addiction, and things like that. I have clients that come to me, and I think we've talked about it a little bit before. People try to self-medicate and things like that, and they come to
Sure.
me. And of course, I always direct them to a physician, but they come to me and say, well, I started, doing drugs because I'm in pain all the time.
Right.
Mm-hmm.
Yeah.
And then my doctor quit prescribing to me, and this is where they're at. So I always try to,
Sure.
pass on the info to
Yep.
to you guys and stuff. But with that, there's just a whole big web of issues with inflammation. So
Another thing that we do with our patients is when they're doing a detox program and they're detoxing from alcohol, or we're detoxing them from opiates or any other drug, quite frankly, we always have James come in and work with our patients during the detox program. James, talk a little bit about the benefits of using IV hydration during a detox.
So as you're detoxing, number one, you get dehydrated. You're already probably dehydrated so bad when you come
Yeah.
in here. It's just unreal. And like I said, you can't drink enough. You're just not in the mental state to really, really focus on your health.
Right.
So what we do is we'll come in and we work with Dr. Flowers and the team, and we just say, hey, what are we looking for? Are we looking at a nutrition deficit here? Are we looking at just using fluids and electrolytes? And so with that collaboration, we'll decide on maybe like a Myers strip, which is the gold standard in our field, or we'll boost the immune system if they're sick from being so stressed out,
right?
Or if they just need fluids and electrolytes, that's what we'll do. And then from that standpoint, once they I've seen them, once they kind of start feeling better after a drip or two, you guys, I think, take over and just really have a chance for them to focus on what they need to do to get their health back to.
Absolutely, yeah.
How soon do they do that? So once they check in for their private detox?
Yeah,
is it
in
right
our
away?
Concierge detox program, they can do it that night, the day they come in. They can do it the next morning. There's not really any standard protocol or medical procedure for it, other than, if they're dehydrated and they need this, then certainly our medical director will order that, and James will come administer. Yep.
Because they really shouldn't detox on their own, because it can be very uncomfortable. And
absolutely.
And if they try it on their own, they can seizure, right?
Certainly.
Course,
Oh, yeah.
yes.
Yeah, the two most deadly detoxes are alcohol detox and benzodiazepine detox, and can result in seizures and ultimately death if you try to detox on your own. So do it in a very safe, medically supervised way with the assistance of something like this. Just really eases the process and helps that patient progress through, so that then they can do an evaluation and do some good treatment.
Yeah, good. And so this is probably a really good segue to that NAD that I've been hearing about. Can we talk about that?
Sure, yeah. So something we're bringing on slowly, just because it's a kind of a new line for us. Actually, it's been around since the 1920s. NAD is basically a vitamin B3 derivative of niacin, and it works on the metabolic function of the cell. So in the mitochondria, basically it goes into the cell and creates and converts into ATP, which is energy. Energy is the source of all health.
It is.
If you do not have good energy going through mental and physical, through your cells, everything, you are not going to get healthy.
That's right.
So that's the source. So it's kind of basically just revitalizes the cell and allows the cell to become healthy again, and let it do its job.
Right. Absolutely.
What does NAD stand for?
I know you're gonna ask me. Robin.
Yeah,
Sorry.
I know. I always have to look it up too.
I always have to relook at it.
Long.
Yeah.
But you know what? The good thing is we have it right here, and you can look
We
it
have
up.
it right here.
Yeah. So all the other things that these drips can do, it's for chronic fatigue syndrome, low energy, weight loss, dehydration, colds, flu, jet lag, headaches, allergies, which I found interesting. Huh?
Yes, yeah, for sure. I mean, all allergies are, that's basically your immune system, autoimmune system, basically attacking itself, and just goes into overdrive. So creates an allergy of some sort. And there's different allergies. I mean, I'm not an allergist, so I'm not going to get into all that. But basically, I mean, you can beat your allergies by figuring out what the source of the of the problem is, what you're being exposed to. And sometimes it's high or low amounts. But so nicotinamide adenine dinucleotide is NAD.
So could you repeat that, Robin?
No.
Right, let's do it once.
I can't. I'll just tell you I can't.
Right.
So do you have an anti-aging drip?
So
I'm hearing about
so basically, along with multiple antioxidants such as glutathione, I think that from what I've seen and what I feel actually with us doing a little bit of NAD, that's a great anti-aging drip as the NAD.
Is.
So not only can we use it in drug detox, alcohol detox, but it's also being used in small injections too. For just anti-aging, reversal, and slowing down basically the process of wearing down your cells, so keep them revitalized. So, but along with glutathione too is really, really good for you.
I was telling James several weeks ago that there was a company out in San Diego that would produce NAD and sell it in a liquid form, and you would take a little capful. I would take a capful of it every morning. This is when I was living in Austin for a couple of years, and and the supplier, I'm not sure why they didn't make it, but they didn't. And but I will tell you what, I have never slept better in my life.
Really?
Never felt more. When I say energy, I don't mean I was hyper energy. I just had enough energy to do healthy energy that I needed to get done throughout the day. And the hours that we work in this in the business that we work in they're odd long hours, and it would always get me through the day. And guys, it's thundering and lightning like crazy in Houston
Yeah.
right now. So
Won't
if
stop
you hear
storming.
noises in the background, that's our beautiful weather in Houston. But anyway, I felt refreshed. I felt younger. I felt energized. Slept better. Everything was weight control. It was amazing. And then I stopped, and I could feel the decline. It wasn't a withdrawal decline. It was like just over time. Your 50-something-year-old body comes back and says, "Oh, I'm tired. My knees hurt again." Right? And I'm tired from working 14 hours. And so I'm super excited about next week. I think we're going to do
let's do it. Yeah,
a 4-hour NAD IV infusion, which I think is going to be amazing, and we're going to try that and kind of add that to what we're doing. Offer that with our patients and those that we work with.
So Robin, can you see in Dr. Flowers' face the stress kind of going?
Yeah, right.
You can feel the magnesium kicking in. Yeah, okay.
Can you tell I'm calming?
Calming down a little bit.
A little nappy.
Yeah.
Everybody, I'll be back.
It feels great. It feels
Tell
great.
me how long a bag typically takes to get through.
Depending on what's going on. If there is some health-related issues, most healthy people can do it in about 30 to 35 minutes.
Yeah.
Okay.
We do not push it. If there's some health-related issues, we slow it down, and we always work with the physicians here, especially Jay Flowers, what's going on with them, with the specific to the client.
Yeah,
Okay.
absolutely.
So, but I mean, we can do it over an hour if we need to, hour and 15 minutes. Now, the drip we're talking about, NAD, now that takes quite a few hours. We're going to do it over a 3 to 4 hour period.
Why does it take so long?
Well, because it causes vasodilation, and so basically it causes a flushing effect like niacin does. When people say I have a niacin allergy, it's not a true allergy. Basically, it's a flushing effect from the vasodilation. And so it's really uncomfortable if you do it too fast. You can kind of get kind of nauseated. So you do it over 3 or 4 hours.
Yeah, absolutely.
So.
Yeah.
And that's very important. So if anybody does a NAD anywhere else, just let you know that.
Right.
Make sure you do it slow.
And are you going to be sleepy after that, or what's the fallout from that? The NAD?
No, I don't. I've never felt sleepy. I've never done the 4-hour drip. I've always done just that short, quick liquid form of it. But I don't think there's going to be a sleepy effect.
No.
Maybe calmness.
Yeah,
but,
calmness.
Yeah.
You will calm down. Yeah, it'll just kind of calm you, but you're not going to sleep. Now,
No.
that night, they say you sleep really, really well.
Yeah.
And then the
good.
next day is actually the best benefits of the drip. They say you wake up and it's just, you're clear as a bell. And if you do the 4-hour drip, they say that it lasts for about 2 weeks.
Yeah.
It's just
good.
really, really, really good.
Yeah.
So,
Man, the timing on that is good for you
Yes,
right now.
it is.
Yeah, it is.
Absolutely.
Yeah.
Yeah. Super excited about that. What were you going to say?
No, I was just going to say you have some NFL clients, don't you? You do
so
this for a lot of NFL
we do a lot
players.
of professional athletes, and then really specifically a lot of very, if you want to say, go-getters, I guess, it's like CEOs of companies and CFOs and people
could
that
see
are in
that.
high-stress situations. They've got to
Yeah.
travel and they've got to be on the game. And so we do a ton of, weekly with some of them. I'll literally just walk in their office because we know them very, very well. And we already have their drip down. And that's one thing we do also is customized drips. So I already have their drip ready. I'll walk in while they're having meetings with their lawyers and just hook them up,
Yep.
whatever fits their lifestyle.
Yeah.
So we do that.
Absolutely.
But yeah.
Walk the audience through some different options for IV hydration, different cocktails, I guess you would say. Like you have the Myers cocktail and an energy.
So what we did, the Myers is the gold standard, and everybody can get just fluids and electrolytes. But past that, what we did was we felt like we wanted to open up to the general public, like what we can do, and we thought we'd do that through marketing. So we created some drips, such as the Gwyneth drip and the Immunity Warrior drip. So the Gwyneth drip is our antioxidant. It's got high-dose vitamin C and glutathione, which is a major antioxidant. It's really good for your liver and skin. And detox. And then also our Immunity Warrior came about before COVID, actually, but we used it during COVID. Our clients saw great results with just helping boost their immune system. That has high-dose vitamin C and zinc in it.
Yep.
And then we also have vitamin D. We can go along with that too.
Yeah, absolutely.
Injections. But so we have all kinds of options. We can make you energize. We can make you relax. We can just replenish whatever you need. And if your doctor says you need magnesium, we can do magnesium or whatever,
Sure. Yeah.
whatever the minerals you might need.
Yeah, very cool.
Is that something that it doesn't have to be prescribed then?
So what we work on is just a wellness protocol.
Okay.
So if your doctor prescribes you vitamin D and he wants X amount of units or whatever per month or whatever at each injection, we can do that. We can follow that,
Sure.
and we just get it approved through our medical director. And by the way,
Gotcha.
we do have a medical director, and that's what some people.
to know.
The stigma of what we do.
Yep.
Some people don't believe that, but we actually do. You have to have a medical director
Sure.
in order to do
Yeah.
what we do.
You don't always get an RN though coming to give. A lot of
Mm-hmm.
other companies don't necessarily have an RN administering the dose. So I think it's really cool that you do that.
We do. Yes, we are. Everybody that administers IVs through us will be an RN
Yeah.
or above.
Yeah.
There are companies, from what I'm told, that don't do that.
Yeah, absolutely.
And a male RN, ladies.
There you go. Love it.
Hey, that's
I love
normal.
it.
I love it.
Fantastic.
So what are the best candidates for something like this, and what are the worst candidates for something like this?
The best candidates, I say everybody's a candidate for this, with the exception of, if you have congestive heart failure, you have some stuff with your kidneys going on and things like that. That's not very safe
Sure.
for us to do. We send those people back to their doctor or to the emergency room
Yeah.
if they need fluids.
Okay.
But if you're relatively healthy, the best candidates, honestly, are the autoimmune people and people that are highly stressed out.
Yeah.
Highly
Yeah.
stressed out.
Yeah.
It's like stress is on the rise nowadays,
It
and
is.
you don't
Yeah.
realize how dehydrated you get until you have a bag of fluid and you're like, wow, I feel so much better. So the best candidates are just people like that, and just every day just trying to keep up with their lifestyle,
Right.
or
Absolutely.
their work life.
Yeah. I agree.
But again, the worst clients really, we do a registered nurse can do an assessment at the time of the drip, and then we turn away people and we
Yeah.
say you're not a good candidate for
Right.
this. We're more under the wellness rather than healthcare.
Yeah.
So yeah, what would be some of the reasons you'd have to turn them away?
Congestive heart failure,
Oh.
any type of kidney disease, and we divert to our medical director but most of the time we just go ahead and turn them away because they need to be under
Yeah.
a different
Medical
evaluation.
supervision,
Yes.
How
Sure.
young can
Clinical
someone
setting.
be? How young and how old?
So our company basically will take people that, because there's so many athletes, we'll take a 10 or 11-year-old that's around 100 plus, 105 pounds.
Yep.
As long as
Okay.
they compensate like an adult, we can do
Right.
the assessment. Now we
Cool.
don't just take them, say we're going to do it. We come
Yeah.
and talk to them.
Yeah.
We assess them first.
Right.
But if we think if it's safe and maybe they're just run down from playing ball all summer, or maybe they just have a stomach bug and
Sure.
stuff like that, we can
Yeah.
do those
Yep.
things. But that's definitely highly scrutinized in terms of the way we do the assessment,
Right.
and we refer to our medical director for that.
Nice. Very good.
Well, I love that it's concierge, it's custom, right? Everything for
Yeah.
everything that we
Yeah.
do.
Absolutely.
That's the beautiful thing,
Yeah.
and it's
Yeah.
super popular with our patients.
Our clients get so, I guess we have such a great and trusting relationship. Like they'll literally, have an appointment at 1 o'clock. They'll have the door open, sitting on the couch. Come on in, it's
Yeah.
open. Their arms already out, ready to go. Like, okay, hook me up.
Yeah.
I'm just relaxing.
I'm just relaxing.
And
here,
so,
lady.
yeah, we just hook them up. Hey, how are you? And we're good to go. So,
Right.
yeah, it's
Well,
Sit there
we
and
had
chit-chat.
that where you guys just went from office to office and you hooked us all up. And the beautiful thing is you can keep working. Like I had it hooked up and I was still doing calls and on the computer,
Yeah.
and you just let it drip, just like
Yeah.
you're doing now.
Yeah.
I mean, it just
It really is I think it's really a great asset to have this as part of a wellness program.
Oh, yeah.
Part of your own wellness program. If you're an athlete, if you're a non-athlete who just needs to stay energized and feel a real positive energy and stay hydrated. I don't drink enough water. I
Right.
know that.
Mhm.
I just don't drink enough water. And this helps, right? I
Yeah.
need to drink more
Yeah.
water, but this also helps. So
that's a good segue to what's the difference between if I just drink a whole bunch of water and stay hydrated that way versus just,
yeah.
okay.
this is a substitute.
Yeah, so to revert back what we were talking about, it goes straight into your bloodstream. So you're getting 100% of hydration, and your body is using, your cells is using every ounce of fluid that we give you. Okay,
Yeah.
if you drink water, if you're young and healthy, you might be able to absorb 20 to 30% of what you're actually drinking, and your body eliminates the rest.
Isn't
That's
that
just how your
wild?
body
Yeah.
works, right?
Yep.
It's trying to, it can only take in so much at one time, right? And if you're a little bit older, you're stressed out, maybe you have inflammation in your gut, you're probably not even taking in 10% of what you
Right.
actually drink.
Yep.
So you're just kind of eliminating it, and your body's not actually soaking it up. Your cells are not actually using it.
Right.
Interesting.
So that's a large difference, and the immediate result of hydration is why we do this.
Yeah.
People are like, I've got to go. I have a business meeting and I'm run down or whatever.
Yeah.
Maybe they had a late business dinner and they had a couple glasses of wine, which I don't promote, but hey,
Sure.
it happens, right? And they'll call
Yeah.
us and they'll say, hey, I'm just kind of run down, and immediately they
Right.
feel better.
Sure.
So, and then that's definitely the benefit to this for sure.
Yeah, it is, absolutely. James, thank you so much for doing this with us, and we
Yeah.
appreciate you being a part of our practice and working with our patients every day, and we love having you around.
Awesome.
And thank
Thanks,
you
y'all.
for this, and I'm
Yeah.
looking forward. We'll do a follow-up on the NAD because I would love to do an entire session
That sounds great.
podcast on what NAD is, the benefits of NAD, and how it can be part of an ongoing wellness approach. Yeah.
Perfect. Yeah,
So,
that'd be
thank
great.
you very much.
Yes.
And
Yeah.
if folks want to learn more about you and what you do, or get an IV drip, how do they find you?
bouncehydration.com.
Yep.
So that's the easiest way, and just give us a call and we'll schedule you. And then if you specifically want me, you can ask specifically for me, and I'll be there at the appointment and we'll talk about it and see what we can do for you.
Awesome. And how long does it take them if they call for an appointment? How long does it get in usually?
We're getting busy, so sometimes it's hard to get in that day.
Yep.
Okay.
But I do my best. But usually within 24 hours. Yeah.
Oh, good. Good to know.
I do where we do our best to get you in that day.
Yep.
Yeah.
Pretty quickly.
This would be a really great gift for someone, right?
would.
This would be
Absolutely.
great for a company to give it to a benefit to their employees,
Yeah,
right?
for sure.
Corporate gift,
Yeah.
things like that.
Someone special, just a set of flowers, send us.
Right.
Absolutely.
You know what? It's
Doesn't
your
get
1-year
more.
anniversary. We're going to buy you an IV.
There you
We
go.
have
Today's
worn
our-
you down,
I know.
Perfect.
Robin
Love it.
French
Thank you
Plant.
for being
Love
here
it.
for a
There
year.
you go.
I need a drip.
That is so good. That's
Exactly.
perfect.
You're giving me a few
Yeah.
drips, honey.
Hey, I like saying I need a drip instead of I need a drink.
Well, that's
There
true.
you go.
Yeah,
I love
yeah,
it.
that's a
There
good
you go.
tagline
Yeah.
for you.
Exactly.
Yeah.
Yeah.
Perfect.
Thanks, everybody, for
Yes,
being
thank
here
you all so
today.
much.
And I want to remind everybody watching or listening to us that there's numerous platforms to find our podcast: YouTube, Apple Podcasts, SoundCloud, Spotify, Stitcher, and iHeartRadio. Please
Nice.
share this episode on social media
Wow.
or with someone that you think could help. And we want to remind you, too, that a clear diagnosis is the key to the most effective treatment possible.
Absolutely. Yeah.
Thank you, everyone.
Yeah.
Thank you
Thanks,
so much.
everybody.
Thank you all.
Bye.
Taking care.
Thank you.
Yeah.